Diagnosis, we must know about the diagnostic test and the screening test. So what is diagnostic test? Diagnostic test is a procedure performed to confirm or determine the presence of disease in an individual suspected of having a disease, usually following the reports of symptom or based on medical test result. So for enteric fever, the diagnostic test is blood culture and it takes more than 72 hours. And let's come to the screening test. A screening test referred to a medical test or a series of tests used to detect or predict the presence of disease in at risk individual within a definite group such as of population, family or workforce. A screening test may be performed to monitor disease prevalence, manage epidemiology, aid in prevention or strictly for the statistical purpose. So in case of enteric fever, we perform BASU, BASU. BASU means B for blood culture, A for agglutination test, S for stool test and U for urine test. So the definitive diagnostic test for typhoid or enteric fever is blood culture and it takes more than 72 hours to get the report. So patient will go to see the guard. So we normally perform vital test, that's the agglutination test. It's a fast screening test to detect the disease. It's a very fast. So we perform the screening test, vital test, which is 70% specific, and later on we perform a stool test and urine test. We discuss about what is the palliative test. So in palliative test, we can see complete blood cell or full blood count. In complete blood cell, we see TLC, total leukocyte count. It's a decrease, and neutrophil might be normal or low, and lymphocyte, as a doctor we see it's a high. So leukopenia happens and ESR might be elevated, and we can perform second test is ESR. Third test we can perform CRP. C-reacting protein means carbohydrate reacting protein might be positive or elevated. ASO titer, we can see whether the urine have some problem or upper respiratory tract infection, either there is streptococcal antigen is present or not. And we can see in case of second stage of complication, we can see whether the patient having intestinal perforation or not. We can perform abdominal plain X-ray, supine and erect position. So what we will see in the X-ray, we can see there is a gas bubble present in the. We can perform ultrasonography to rule out whether the patient having gallbladder abnormality, might be cholecystitis, cholelithiasis, the patient having splenomegaly or not, liver some abnormality or not. So we can do that, and whether the patient having kidney something like a hydronephrosis happen, it's a rare. We didn't assume a lot of patient having hydronephrosis. So we can do echo also. We can do why, whether the patient having myocardium or not, myocarditis or not, and uric acid and RA factor also we can perform. Beside this test, there is no need of performing. Maybe liver enzyme is elevated or not, you can perform